I'm Tori Lindsay, and I'm doing my case study on a pulmonary embolism. So my patient is a 21-year-old female. She presented to the emergency department with history of muscle fatigue, dizziness, sharp chest pain, exertional dyspnea, and exhaustion. And she is a Division I athlete, so she's in pretty good shape and has regular workout routines that she does. And she started having a drastic decrease in her performance when she was doing those workouts, difficulty breathing, and then feelings of heaviness in her legs during those workouts. So she came to the emergency department, and the first thing they did was a physical exam, and then they got her lab work done. So her lab work, her blood pressure was 134/60, her pulse was 80, and her respirations were 14 breaths a minute. So all fairly normal. Her electrolytes were normal, and then she had normal blood count. So she had a history of using oral contraceptives for 16 months, but besides that, she wasn't on any other medications. And so after everything with the physical exam and the labs came back kind of normal, they sent her to CT for an angiogram. And that angiogram showed extensive pulmonary emboli in both lungs and a small left pleural effusion, and then left lower lobe pulmonary infarction, which a pulmonary infarction is when blood gets blocked in the lungs, so a section of lung isn't getting blood flow, and so that section of lung tissue can start to die. So a pulmonary embolism happens when a blood clot breaks loose from somewhere in the body, and then it travels to the lungs where it causes a blockage, usually in a lung artery. And a lot of times these blood clots form in the vessels in the lower leg, which is called deep vein thrombosis. So if that deep vein thrombosis is caught earlier in the legs, it can actually be treated and usually can prevent a pulmonary embolism from happening. So there are a lot of risk factors and symptoms with pulmonary embolisms. So some of the risk factors are heart disease, cancer, surgery, clotting disorders, smoking, reduced mobility, a sedentary lifestyle, use of oral contraceptives, and prolonged air or ground travel. So we know our patient was using oral contraceptives, and she had actually also just returned from a trip where she used air travel. So she has a couple of those risk factors. So the symptoms, some of them are shortness of breath, chest pain, cough, irregular heartbeat, dizziness, fever, and leg pain or swelling. So some of those are kind of general, which is one of the reasons that this can be difficult to diagnose early, because those symptoms are the same symptoms for a lot of other things. But pulmonary embolisms are pretty serious. They can be life-threatening, and a third of the cases that go undiagnosed and untreated end in fatality. So it's a pretty serious thing, but if it is diagnosed early, then the outlook is a lot better. So survival rate after 3 months with treatment is 82 to 85%. So usually to treat this, they'll use blood thinners, compression stockings, leg elevation, physical activity, and pneumatic compression. So, like I said, when our patient's physical exam and lab values looked pretty normal, they sent her for the CT scan, which is where the pulmonary emboli showed up pretty clearly in both lungs. So they treated her with fluids and blood thinners, and she continued taking the blood thinners for 6 months afterwards and didn't see any other ill effects or any recurring symptoms at that point. And this pulmonary embolism was most likely caused by her using the oral contraceptives. So there's a known correlation, especially young women that use oral contraceptives, with pulmonary embolisms, and it's because they found a relationship between estrogen and blood clots. So this patient switched to an IUD instead of the oral contraceptives. So this picture is a picture of a normal chest CT. So you can see right here in this picture is the lungs and the heart. So you can see the upper lobe, the middle lobe, and the lower lobes. You can see the lung markings and some vessels in there, the minor fissure and the major fissure, and also some airways. So these CTs are from our patient. So on the right side you can see we've got the liver, you can see the vertebral body, ribs, and then you can see some lung markings and lung tissue. And on that right side is also where our pulmonary infarction is, so that's where that section of tissue got blocked from blood flow and started to deteriorate and die. And then on the left side we've got the heart, the aorta, vertebral body. You can see some ribs as well over there. And then this is, on the left side is where you can see the pulmonary embolisms on the right and left lung, which I think if you haven't looked at a lot of chest CTs, this can be pretty difficult to see. I had a hard time seeing it because it kind of looks just like vessels, but you can see just some brighter clumpings of white circular objects, and those are where those pulmonary embolisms are. And here is my page of references, and thanks for watching.